Hi, this is Dr. Anuj Shah, the director of Apex Heart and Vascular. And every year, towards the end of the year, I talk about all the interesting stuff that has happened in the world of cardiology and vascular. And I want to summarize 2020 and the top five landmark advances in the world of cardiology. Number one, obviously, we can't talk about 2020 without talking about COVID 19 infections. So, how is it related to cardiology? We found out that more than two-thirds of the patient who, of the 300,000 plus patients who died of COVID 19, more than two-thirds of them had a component of cardiovascular disease underlying. So once again, it proves that cardiovascular disease remains one of the biggest comorbidities. History of MI, hypertension, diabetes, all that stuff. And of the people who died from COVID-19, unfortunately, around 10 to 20% died of myocardial infarction or arrhythmias and other cardiovascular reasons. So if you have heart disease, you are at risk of COVID-19. And if you have COVID-19, there is a high chance you will succumb to ultimate fatal cardiac event. We also saw specifically higher incidence of arrhythmias and myocarditis, as well as pericarditis with pericardial effusion. So COVID-19 is super tied to cardiovascular disease. Also, people ended up getting a lot of thromboembolic events, including DVT and pulmonary emboli, which ended up causing right-sided heart failure symptoms as well. So once again, if I have to summarize 2020, number one cardiovascular things that we need to pay attention is COVID-19. What is number two? Number two, in my opinion, is hypertrophic cardiomyopathy. For years and years, we are struggling to deal with hypertrophic cardiomyopathy and what we need to do. Now we have a new trial called Explore HCM, which looked at the new drug meracarbten. This new drug is a novel therapy, and what we are seeing is, in addition to beta blocker, having this medication will lower the symptom severity, New York Heart Association class for heart failure, as well as it will keep people out of the hospitalization, and there might be a trend for mortality benefit. So again, I think the hypertrophic cardiomyopathy, we have a landmark trial which is going to change the paradigm of hypertrophic cardiomyopathy. So that was my top advance number two. Top advances in 2020, number three for cardiology. Again, we cannot talk about cardiology without talking about TAVR, which is transcatheter aortic valve replacement. We know that nowadays when people have symptomatic severe aortic stenosis, we don't need to open the chest anymore. We can fix large majority of this aortic stenosis with transcatheter based approach. We know that therapy works better than surgery for high risk population. We have data now that even in intermediate risk population, TAVR has outcomes favorable to surgery. And now finally, we are trying to compare the two TAVR versus surgical AVR, what we call SAVR, in low risk population, and we are seeing advantage even in that. So next year, we're going to watch for low risk patient population and see what the outcomes are for surgery versus TAVR. But TAVR always remains very exciting, and new trials are coming out. So that was top advance number three. Top advance number four is diabetes treatment. Believe it or not, SGLT2 inhibitor. These are a group of diabetic medications which are not only helping with diabetes patients, but they are actually making a really incredible difference in patients with congestive heart failure and improving cardiovascular disease outcomes. So in my opinion, SGLT2 inhibitor is a great another beautiful advance in 2020 that we are finding. And top advance number five is mechanical circulatory supporting devices. So we know that there is Impella, which is a percutaneous left ventricular assist device, which is a small catheter we put from the groin. And when people have failing heart, whether it's from acute myocardial infarction or other reason causing cardiogenic shock, these Impella devices can come and help. What has happened in 2020 is we have something called Smart Assist. So Impella can provide up to 2.5 liter cardiac output every minute additional for Impella 2.5. Then we have Impella CP, which provides up to 4 liter support, and we have Impella 5.5, which can provide 5.5 liter support. And now we have interchangeable Smart Assist, so we don't need to take the whole device out and put a new device. The same device can stay in, and we can escalate the therapy, which is making a big difference in people with failing heart. So I think Impella and advancement in Impella is obviously big. ECMO, which is this age-old supporting device, is actually having a comeback because in a lot of COVID patients who are very sick with acute respiratory distress syndrome, ECMO actually came and also helped these patients who were very difficult to wean off the ventilator otherwise. So I think we're gonna see a lot of advances in the circulatory devices with ECMO and Impella, and we're also doing something called ECPella, which is the same patient will get ECMO and same patient will get Impella. So again, tune in for 2021. Very excited. The vaccine is out. Hopefully, COVID-19 will become history. And in the meanwhile, please stay safe, have great holidays, and keep your mask, okay? Because the masks are still working. Social distancing is still working. Once again, I want to wish you and your loved ones excellent holidays.